Hello, my name is Gemma and I'm currently enrolled at Deakin University's Warrnambool campus as a second year nursing student. In today's presentation I will be exploring and discussing the role of the perioperative nurse when planning a patient for day surgery. Day surgery, as defined by the Australian Day Surgery Council 2004, is when a patient who undergoes an operation or procedure is admitted and discharged within the same day. A lot of planning and preparation goes into a successful day surgery, and most of which is done by a perioperative nurse. A perioperative nurse, as defined by Al Hamlin et al. 2011, is a professional who provides complex care for patients in high dependency situations. Hamlin et al. Also continues by stating that a perioperative nurse must have effective management in collaboration with other health professionals and work as a safeguard and advocate for the patient. This is especially important within the pre-operative role. There are a number of key areas within the pre-operative role that encourage a smooth and successful post-operative recovery, first of which is pre-operative assessment. According to Malley et al. 2015, pre-operative assessment requires the nurse to carry out both direct questions and physical examinations on the patient to assist in defining a patient's risk factors for poor surgical outcomes. Each hospital has its own individualised set of checklists for pre-operative assessment. However, some general questions that are asked include patient's personal details such as name, age and address, patient's current health status and any relevant health history, any allergies, regular medicines or herbal supplements, and next of kin details in case of an emergency and planned discharge transport. As well as questions, physical examinations are required depending on the type of procedure. For example, Pritchard 2012 investigated the importance of skin integrity pre-operatively, especially for patients undergoing most orthopaedic surgeries. This is because even a small cut on the skin is a portal for infection, which can end up in the bone with dire consequences. It is the pre-operative nurse's role and duty of care to carry out a number of pre-operative physical assessments, which may include the patient's height and weight for anaesthetic requirements, physical health inspections such as looking for skin infections and listening for respiratory problems, a urinalysis and baseline observations including blood pressure and heart rate to compare with intra and post-operatively. If any alarms are raised by the pre-operative nurse during these assessments, it is then up to the doctor or surgeon in charge to decide whether or not the surgery will continue. Another key area for pre-operative assessment is the education and consent of the patient. According to Anderson and Wern 2007, consent is only valid if the patient is competent enough to make the decision and has received sufficient information. As the planned procedure should have already been discussed between the patient and their surgeon, the nurse will only need to give an overview of the procedure and what to expect pre, intra and post-operatively. It is fundamental for the pre-operative nurse to reiterate to the patient the importance of the immediate post-operative care, such as deep breathing and coughing, pain management and fluid intake. After the patient has showed their understanding for these, they can then give their consent. Ultimately, the role of the pre-op nurse is to facilitate care that will lead to the safe and fast recovery of a patient. Thank you.